For patients hospitalized with COVID-19, recovery can be a long process. This week, New York-based Catholic Health opened a dedicated rehabilitation center to help with their care. The center, a former Catholic nursing home, is the first facility of its kind in Western New York. It provides both rehabilitation and medical care for COVID-19 patients who are discharged from Catholic health hospitals but aren't ready to return home. Joining me now on Skype is Mark Sullivan. He is president and CEO of Catholic Health. Mark, welcome to the show.
Thank you, and I'm glad to be here.
Well, we're learning more and more every day about COVID-19 and the toll that it takes on patients, especially those who've been hospitalized because of it. Can you tell us about your continuum of care approach in helping those recover?
Sure. Well, first, I'd like to start by letting everyone know how important healthcare heroes are out there around the world that are fighting the COVID virus, and we're very fortunate to have them at the forefront. Catholic Health has a continuum of care that we put together. We've created the first COVID treatment center at St. Joseph campus of one of our hospitals. We converted within a week. And now, as you just mentioned, we've converted a nursing home that was closed, a non-Catholic nursing home, to provide the continuum of care. We feel it's very important that we lead healthcare, much like our founders and foundresses did so many years ago. So the way that the health system works is our hospital is a COVID-only hospital. We can take up to over 200 patients there at the time that they can be discharged. Now they'll be able to be discharged directly into a Catholic facility, which will enable them to recover from COVID, convalesce, shed the rest of the disease, and then move on to their home and to their regular lives.
Mark, what role does faith play in all of this?
I can start with our founders and foundresses. Catholic Health was founded by the Daughters of Charity, the Sisters of Mercy, the Franciscan Sisters of St. Joseph, and the Diocese of Buffalo. You need to rewind back 173 years ago when Ursula Mattingly, the Daughter of Charity, came to Buffalo and founded the first hospital in Buffalo. After that, we go to 1916. We know that Sister Mary Agnes, the Sister of Mercy, started the first Mercy Hospital. And then just thinking of Sister Angelica back in 1981, we have to follow these women religious. And I tell my team all the time that a cholera outbreak, no GoFundMe page, no internet, no statistics, but just going on your faith. Faith is all we talk about at Catholic Health. We know that the faith is the absence, or fear is the absence of faith, and we really focus on that. We're founded by wonderful leaders and women religious and ordained, and we need to continue that healing ministry and reveal the healing love of Jesus to all. We're all inspired by that every day we come to work.
Wonderful. So wonderful to hear that. What are you seeing in terms of the need for long-term care for COVID-19 patients, and how exactly will your new facility help them?
What we did is work closely with Governor Cuomo, who's been an outstanding leader for us in New York State. It's important to think of when we look at the surge of healthcare, you're going to have patients that need acute care services. My background is non-acute care, so I asked myself and our team, what happens to these patients when they're ready to be discharged? Because we may need those beds for other patients. Erie County and the Buffalo area is the largest hotspot outside of New York City, so we need to prepare for that. So this site that we have opened, 80 beds, we walked through the site one day, and within 7 days, we had it totally converted into a faith-based facility with the help of the Department of Health of New York State, and it really helps the continuum. So our ability to move patients within our Catholic network enables us to deal with the surge, enables us to deal with different dynamics a patient may have, and really try and support the community in a way that we did over 170 years ago.
Mark, I'm curious, how has what you learned in caring for COVID-19 patients, how has it helped you in the design of this facility and also in keeping patients and medical staff safe?
It really is a force multiplier. If you picture this, in a typical hospital, you'll have a COVID patient, maybe a regular patient, a COVID patient. And the challenge we've had is that you use a lot of personal protective equipment, or PPE. So you're going to be changing your gear, if you will, between the different rooms. So at the St. Joseph campus, the treatment center, which is the hospital we converted, we actually have seen a reduction in utilization of PPE by almost 75%. Now, we're using PPE appropriately, but we've been able to take the hospital, much like the nursing home, and break it into 3 sections. We have a green section, which I could walk in dressed like this. We have a yellow section, which means you're going to be transitioning into where COVID patients are, and a red section. 75% of the hospital is a red section. So that means as the caregivers move, when they get to the yellow section, someone is helping them dress in their PPE, checking to make sure it's all done properly, and they go to work their shift. They're not changing between rooms except if it's necessary with particular isolation gowns, et cetera. The same is applied at the nursing home. So we took that same strategy, and just to keep it in perspective, it was just March 19th that we announced the St. Joseph campus converting to a treatment center. And ironically, at the end of the day, someone texted me and said, "Do you realize that that's St. Joseph's Day that you converted St. Joseph Hospital?" So there's your faith base again. So what's enabled us to do is, as a force multiplier, is take the care and have it in a concentrated area in a facility. And when you go to the COVID nursing home, the whole nursing home is COVID patients. So we have a separate area that's green, a separate area that is yellow, and the area of treatment is the red zone. So people that go in there know that the patients are being cared for in a very respectful way. Probably the most revealing areas is we have chaplains that go into the red zone with chaplain on their chest or wearing a crucifix, and the staff just resonate and come to them for the support that they need. We're very proud of the care we provide. We know that many patients won't make it, but we also know that we're going to save a lot of lives. And so we spend time with the dying right to the last breath. Our staff is there with them. And for our staff, they came up with this wonderful idea at our treatment center where if someone is discharged, and we discharged over 173 people at this site that would have not made it if they weren't treated for COVID, there's a song played. There's multiple songs played throughout the whole hospital. It just reminds those nurses, caregivers, spiritual care leaders that got into a faith-based ministry because we want to reveal the healing love of Jesus to all, that there is hope in everything that we do. And we've kind of changed our name in a way from Catholic Health to Catholic Hope, because it's the spirit and the light that guides us to deliver during the most difficult times. And that's what our team has been focusing on recently in the last month with COVID.
Well, Mark, thank you so much. Wonderful work that you all are doing, and thank you for your time today. Mark Sullivan, President and CEO of Catholic Health. Thanks again.
Thank you. God bless.